Hello and welcome to HealthAfrik on AAU TV. Today we bring you an update on COVID-19 vaccines, myths and facts about COVID-19 vaccine. My name is Bridget Amadente. Today I present a set of frequently asked questions about the COVID-19 vaccine and their answers from the WHO, World Health Organization, to help you understand the vaccine a lot better. Question 1. Can a COVID-19 vaccine make me sick with COVID-19? No, none of the authorized and recommended COVID-19 vaccines currently in development in the United States contain the live virus that causes COVID-19. This means that a COVID-19 vaccine cannot make you sick with COVID-19. There are several different types of vaccines in development. All of them teach your immune system how to recognize and fight the virus that causes COVID-19. Sometimes this process can cause symptoms such as fever. These symptoms are normal and are signs that the body is building protection against the virus that causes COVID-19. It typically takes a few weeks for the body to build immunity after vaccination. That means that it's possible a person could be infected with the virus that causes COVID-19 just before or just after vaccination and still get sick. This is because the vaccine has not yet had enough time to provide protection. Question 2. After getting a COVID-19 vaccine, will I test positive for COVID-19 on a viral test? No. Neither the recently authorized and recommended vaccine nor the other COVID-19 vaccines currently in clinical trials can cause you to test positive on viral tests. Viral tests are used to see if you have a current infection. Moving on to question 3. If I have already had COVID-19 and recovered, do I still need to get vaccinated with a COVID-19 vaccine? Yes. Due to the severe health risk associated with COVID-19 and the fact that reinfection with COVID-19 is possible, vaccines should be offered to you regardless of whether you already had COVID-19 infection. At this time, experts do not know how long someone is protected from getting sick again after recovering from COVID-19. The immunity someone gains from having an infection, called natural immunity, varies from person to person. Some early evidence suggests that natural immunity may not last very long. Now, question 4. Will a COVID-19 vaccination protect me from getting sick with COVID-19? Yes. COVID-19 vaccination works by teaching your immune system how to recognize and fight the virus that causes COVID-19, and this protects you from getting sick with COVID-19. Being protected from getting sick is important because even though many people with COVID-19 have only mild illnesses, others may get severe illness, have long-term effects, or even die. There's also no way of knowing how COVID-19 will affect you, even if you don't have an increased risk of developing severe complications. Now to question 5. Will a COVID-19 vaccine alter my DNA? No, a COVID-19 vaccine will not alter your DNA. COVID-19 mRNA vaccines do not change or interact with your DNA in any way. Messenger RNA vaccines, also called mRNA vaccines, are the first COVID-19 vaccines authorized for use in the United States. mRNA vaccines teach our cells how to make a protein that triggers an immune response. This means that mRNA vaccines cannot affect or interact with your body's DNA in any way. Instead, COVID-19 mRNA vaccines work with the body's natural defenses to safely develop immunity to disease. Question 6. Is it safe for me to get a COVID-19 vaccine if I would like to have a baby one day? Yes. People who want to get pregnant in the future may receive COVID-19 vaccine. Based on current knowledge, experts believe that COVID-19 vaccines are unlikely to pose a risk to a person trying to become pregnant in the short or long term. Scientists study every vaccine carefully for side effects immediately and for years afterwards. The COVID-19 vaccines are being studied carefully now and will continue to be studied for many years, similar to other vaccines. The COVID-19 vaccine, like other vaccines, work by training the bodies to develop antibody to fight against the virus that causes COVID-19 to prevent future illnesses. There's currently no evidence that antibodies formed from COVID-19 vaccination cause any problems with pregnancy, including development of the placenta. In addition, there is no evidence suggesting that fertility problems are a side effect of any vaccine. People who are trying to become pregnant now or who plan to try in the near future may receive COVID-19 vaccine when it becomes available to them. Now, our last but one question, question 7. After one has been vaccinated, can one still catch COVID-19, and can one also infect others? Well, the clinical trials demonstrated that these vaccines protect people against the diseases. What we don't know yet from clinical trial is whether or not the vaccine also protects people from getting infected with the SARS-CoV-2 virus, and whether or not it protects against transmitting to someone else. So this is a really important part of our understanding about what these vaccines do. Do they only protect against disease, or do they also protect against getting infected and being able to transmit to someone else, even if you are not having any symptoms? Studies are still ongoing to broaden our understanding on these fronts. Now, our last question, question 8. Does one need to continue with the precautions even after vaccination? And how long are we expected to take these precautions? We really need to continue with these precautions while we are still learning about what the vaccines can do. And right now, we are in a situation where there's still very broad transmission in many countries. The transmission is just out of control. And so for how long we need to continue these precautions is really going to depend on what communities and countries can really do to crush this virus. That's all for now on your favorite health show, HealthAfrik. Thank you very much. We know with this information, you'll be able to make the right decision on the vaccine and stay safe as well as protect others. My name is Bridget Amadette.